Happy World Mental Health Day, everyone, colleagues, wherever you are listening us from. We wish to welcome you to today's celebration, and I would like to welcome our colleagues to give us a few logistical for our webinar. Thank you.
Welcome everyone to our World Mental Health Day, and for today we'll be having a live interpretation. So to be able to access, you can go to the translation interpretation sign with a globe or the more section and interpretation, and then click that and select your preferred language. We have English, French, and Arabic, and you'll be able to hear in the respective section. Please use the first 15 minutes to introduce yourself in the chat, and all the questions thereafter will be posted. Feel free to post them in the Q&A section. Thank you very much. Over to you, Fiona.
Thank you, Joy. It is profound that we connect again today for the World Mental Health Day, the 10th of October, following last year's Mental Health Day. Today's theme is access to mental health in emergency, following the theme for last year, which focused on mental health at work. We want to particularly acknowledge a lot of efforts that you have made individually, colleagues in the field, and a big salute to all of you who have put their life at the forefront to respond to humanitarian emergency across the globe, some challenging, some affecting your own mental well-being. We want to remember you, and we want to let you know that we are together. So today's themes and World Mental Health Day celebration has jointly been organized by World Health Organization, World Federation for Mental Health, and the Mental Health Innovation Network. The objectives of our global webinar today is to raise awareness about the importance of mental health in emergency setting, discuss the challenges and opportunities in accessing mental health support during emergency and building back, share best practice and guidance, tools for providing mental health and psychosocial support during emergency, emphasis for the roles of various stakeholders from governments to NGO to the UN in improving access to sustainable mental health during and after, before, during and after emergency. Now, we want particularly to remember this year's theme today, which is profound, and invite you to our session. Today's theme is not only significant or in terms of emergency response, but we also take time to remember our frontline workers who have put themselves at the forefront in responding to the emergency. We want to remember as well actionable steps and best practices to build back better and sustain quality mental health care before and during and after emergencies. Indeed, we want to discuss insightful discussion and ways of navigating and leveraging opportunities for effective mental health and psychosocial support, as well as the critical roles played by diverse stakeholders in this effort. This year, indeed, is one of its own, where during the UNGA 80, we had the UN Acceleration Plan that is jointly coordinated by WHO and UNICEF, having the first launch for the global initiative for prioritizing mental health in humanitarian emergency. I am your host and moderator today, Fiona Koyet, a Senior Technical Advisor at World Vision International. Together, we have speakers. We have Tushomi Akiyema, the President for World Federation of Mental Health, who shares his profound and deep and personal aspiration on mental health, having his own son ended his life by suicide as a result of having struggled with schizophrenia for 20 years. Our condolence, our deep thought, and indeed our minds are with you, even as you have raised above the bar to fight stigma associated with mental health. May his soul indeed rest in peace. We also bring Fami Hannah, the technical officer, mental health and substance use abuse unit within the WHO headquarters. We also have Raija Abu Sway, the mental health officer for WHO in OPT. We also bring Anna Filorinza Pla, the mental health and psychosocial support global lead at Save the Children headquarters. And we also have Peter Ventago, senior technical advisor within the UNHCR headquarters, and Rita Taye, the mental health and psychosocial support interagency SAGE roster member. Colleagues, we want to wish you a good time during this webinar. And more importantly, we want you to remember that mental health indeed is a priority, not only to humanitarian response, but also to our own mental well-being. Welcome. As we start our session, I would like to invite the first speaker for our session today, Tsuyoshi Akiyama, the president of World Federation of Mental Health, to lead the session in terms of selected World Mental Health themes and relevance. Take stage, Tsuyoshi Akiyama, for your presentation. Thank you, everyone, and welcome.
Thank you very much, Fiona. World Mental Health Day 2025. As you know, the theme is access to mental health services. The effects of war, catastrophes, and emergencies are varied and multifaceted for affected people and also for deployed helpers. The World Federation for Mental Health calls on all those responsibility and stakeholders to support access to services, to support facilities for all people in catastrophes and emergencies. Mental health is clearly a basic human right for everybody. Next slide, please. Millions of people worldwide were and are affected by disasters. Emergencies influence health and mental health of humans. In the case of disasters, all humans and especially vulnerable groups can be under great stress, can face major challenges, and may develop mental disorders. Nearly 1/3 of disaster-affected people may experience burdensome mental health consequences and mental health disorders. This is a message from Sabine. Dehumanization. Especially recently, we may observe this phenomena. Dehumanization is a fearsome word, calling to mind the gravest atrocities of the past and present. People seen as less than human have suffered and are suffering violence, deprivation, exclusion, and disposition, and that suffering has been and is routinely ignored or minimized. Being perceived as less than human may exacerbate an existing mental illness, but dehumanization might also be a risk factor for developing it. Next slide, please. The World News reports countless catastrophes and emergencies. How are these catastrophes and emergencies affecting the mental health of human beings? Is there sufficient access to service to sustain, if not improve, mental health? To tackle the global issues, the WFMH needs to collaborate with its global partners, like all of you. The WFMH would like to find a way to reach you and collaborate with you. Thank you very much. Tsuyoshi Akiyama, President of the WFMH.
Thank you very much. Indeed, this is profound. And I would like to invite our next speaker, Fami, to continue with the presentation on latest data. Over to you, Fami.
Thank you so much, Fiona, and thanks everyone for joining and welcome to the World Mental Health Day webinar. And we thank our colleague at WFMH for selecting this critical topic for the World Mental Health Day. Colleagues, today's theme of World Mental Health Day is simple and urgent. The world is not only facing unprecedented humanitarian emergencies, but also facing unprecedented mental health emergency. In every emergency, there are two phases, one in shattered infrastructures, and the other is in disrupted lives. We need to address both. 1 in 5 people, as you see in the slide, in emergencies lives with a mental health conditions. Yet mental health support is still treated in too many emergency responses, unfortunately, as optional. In today's emergencies, there is an estimated 67 million people with mental health condition living in conflict, disaster, or displacement settings. Next slide, please. In 2024, a historic event in May 2024, when member states has adopted the first ever historic resolution on integration of mental health and psychosocial support, not only in emergency response, but in preparedness and in recovery. It's a critical moment that we need together to choose to act on it. And you can find the resolution here in the QR code, as many other QR codes in next slides. Next, please. Colleagues, coordination is possible and the progress is real. As you see in the slide, data fresh from Mental Health Atlas 2024, 85% of member states affected by emergencies reported to WHO providing mental health support as part of their response. However, service coverage and quality still fall short. Next, please. In 2019, fewer than half of emergencies had MHPSS coordination mechanism multi-sectorally. Today, it's 71%, a proof that when we invest, people can and are able to receive coordinated care and better referral across multi-sectoral services. In 2024, WHO provided life-saving psychotropic medication to 2.1 million people with severe mental health condition in conflict settings such as Sudan, Chad, and Ethiopia, and helped in rebuilding the system in places such as Myanmar, Syria, and Lebanon. Yet this year, at this time of the year, when we compare the data to previous year, it's 94% less, not of psychotropic medication procurement requests in emergencies, not because there is less people with mental health conditions living in emergencies, but because there are competing priorities and funds are vanishing, leaving people with severe conditions in the middle of crisis without support. Despite there is significant progress in statistics, and if we can go next, please, also in preparedness, where there is significant progress, 28% baseline to 48 countries integrating mental health in their preparedness, thanks to initiatives such as the Build Better Before. However, this progress is fragile, and unless we continue to invest, we will have challenges in reaching targets that the member states have set in the Mental Health Action Plan, including those related to mental health and psychosocial support. Next, please. Gold standards such as the Interagency Standing Committee Mental Health and Psychosocial Support Minimum Service Package is setting the standard for rapid, coordinated, costed action across sectors in all emergencies. You can reach this key resource here as well as other resources through the 2 QR codes and some links we will share with you in the chat. Please go to the World Mental Health Day WHO page and World Federation for Mental Health pages. There are several stories, including amazing stories for some of the colleagues speaking to you today about their work in the front line, showcasing their work in investing in mental health and psychosocial support in some of the most challenging contexts in the world. Colleagues, the most powerful aid can be a safe place to tell your story. The most common condition in emergency is actually not a physical wound, but grief. A broken bone may heal in weeks. A destroyed home can be rebuilt in months, but the mental health effects, if ignored, last a lifetime. People don't survive. Humans don't survive only on food, water, and shelter. With mental health and psychosocial support, people can cope, recover, and heal. Let's together ensure that we renew our commitment today in this day for the value of mental health. access to mental health services through building back better, sustainable mental health care during and after emergencies can turn numbers and statistics into a neighbor, and the neighbor into a community builder, a parent who is able to sleep again, a child back in a classroom, a responder who keep serving and building their communities. To responders, colleagues, integrate mental health in your humanitarian operations. To governments, invest in preparedness, it pay back in well-being and economic recovery. To donors, allocate resources for mental health and psychosocial support as a life-saving measure. Wishing all of you, on behalf of the World Health Organization, on this day, health, safety, and mental well-being. Happy World Mental Health Day. Back to you, Fiona. Thank you.
Thank you, Dr. Fahmy. Indeed, you have really given us profound insight there. We can choose to actually prioritize mental health for a better life for many communities. I would like to turn into our next presenter, Raija Abuswe, the mental health officer for WHO in OPT. Over to you, Raija.
Thank you, Fiona, and thank you, Dr. Fahmy, for inviting me for this important day and discussing the importance of integrating mental health into emergencies. Next slide, please. Occupied Palestinian territory is a prolonged and protracted crisis. And since October 2023, the crisis has been unprecedented. The intensity, the destruction, which has impacted the mental health of the people in Palestine, specifically in Gaza. The numbers here are like risk factors for mental health. The injured, the huge number of injured, the displacement, the continuous displacement, the 12,000 children who are identified to be suffering from acute malnutrition and the impact on their mental health. The 29% of women in OPT who reported being a victim of violence, but I mean, this was in 2019. The number increased hugely, specifically in the last 2 years. There is over 39,000 children who have lost one or both parents in Gaza. 17,000 of them, they are orphans. And this, of course, highlights the burden of mental health on these children, on the parents, on the families, the disabilities and the amputations. And the numbers of major extremity injuries is almost 28,000 and more is under amputation and injuries. Next slide, please. So these are like risk factors that I wanted to highlight, and it shows how much the mental health burden is high and huge. And Palestine, before even the war, the crisis and hostilities in Gaza in 2023, was one of the largest burden of mental disorders in the region. So WHO estimates now in Gaza, there is more than 1 million people in need of MHPSS. The hostilities in the last 2 years has affected not only the buildings, the infrastructure, the schools, the shelters, it affected the social fabric. It has tried to break down the family cohesion, which has compounded a very complex trauma and, of course, impacted the psychological and well-being of the people. The crisis had disrupted the whole fabric, the community fabric, and this has caused, of course, increase of level of fear, insecurity, and helplessness. And of course, the continuity of displacement and living in very overcrowded, unsafe shelters where there is no place is safe, which was always, we always heard it from the people there. It has contributed a significant psychological stress. Next slide, please. We as WHO in OPT country office, we've tried to work as much as possible with everybody. The first thing we wanted to really activate the MHPSS technical working group. It was very important to ensure that there is a local co-chairs who are leading this technical working group in order to strengthen the coordination, to have it intercluster, multi-sectorial, and try to map mental health services and to support the capacity of partners and try to strengthen the referrals. all mental health services has been bombarded. The psychiatric hospital in Gaza was bombarded in November 2023. One of our challenges was to try to find an inpatient unit where we can support the people with mental disorders. Till today, we were not able to find that, even though we had lots of efforts with other Ministry of Health and other partners to try to find. The problem was there is always displacement, so and evacuation. So whenever we find a place, then there is an evacuation order, and there is a displacement, not only of the communities and the people, but also for the mental health services, the facilities, and the health workers. They have to evacuate as well. Therefore, we needed to be flexible. We need to find a solution. We need to be fluid as well in finding solutions. WHO ensured as well to ensure drug availability and also to deliver and to enhance integration of mental health into primary care, because one of the challenges is the limited mental health resources, human resources, and specialized services. And also we wanted to highlight the importance of helping the helper and making sure that the carers are always being taken care of. Since they've been working nonstop. Almost 1 million people were provided with mental health support by partners. And also we ensured to train health workers on psychological first aid, trauma, grief, GBV. And it was amazing to see the commitment of health workers in the last 2 years, even though they've been also under bombardment, that they still are committed in providing services for people. Next slide, please. The challenges are ongoing because the hostilities are ongoing, even though we heard the good news yesterday that there is a ceasefire. So we're hoping that it will be sustainable. But the ongoing hostilities, the limited basic needs of the people in the last 2 years, there was no education, the uncertainty, even though, as I said, we have good news, but there's still the uncertainty is there, the feeling of uncertainty, the massive destructions. There would be a huge need and investment of mental health again, to build up the mental health services, because most of them, they were destructed. The fragmentation as well in OPT between Gaza and West Bank, even also West Bank, it has checkpoints, closures, there's financial crisis, there's always settler attacks impacting also the health services and mental health services. It's important to prioritize, and there's limited prioritization of mental health. It's important to invest in mental health in order to have better recovery, as also Fahmi mentioned that without mental health, we cannot have recovery. We cannot have resilience, and we cannot have hope. And I think that's it from my side. Thank you very much.
Thank you very much, Raija. Indeed, we salute you and all other colleagues who are working in this challenging environment. And our hearts goes out to all communities, all children, struggling with their mental health amid the emergency. We want to continue with the realities of MHPSS. And now I wish to introduce our next speaker, Peter Venterville from UNHCR. Over to you, Peter. Peter, your mic is muted. If you can hear us.
Yes, I can. Is it my turn already?
Yes, go ahead.
Okay, then I'll go ahead. I will also show my video then. Next slide, please. Oh no, here you go. So my name is Peter Ventervogel. I'm the Senior Mental Health and Psychosocial Support Officer with UNHCR. And when I was thinking about what I should talk about, I thought I can talk about very many places, because the number of refugees in the last decade has doubled. That's bad news, but even worse is that the funding has not increased commensurately. And actually now in the last year is going very much down, which means that there are many services that we want to provide to refugees which we cannot. I want to take you to one area where the needs are extremely high, but there is also hope. and that is Eastern Chad. You see here the small map, you see Sudan on the right on the small map, and you see that blue circle, which is the border between Chad and Sudan. And that's where massive population movements have happened over the last 2.5 years. Almost 900,000 people from Darfur moved to Eastern Chad. But already were 400,000 refugees from Darfur who lived there for several years already. And very many returnees from Chad went back, because in fact, Sudan was richer than Chad, and people were actually moving there as labor migrants. So they all went back, and their state was not good. Dr. Fahmy has been to Chad, I've been to Chad, World Vision from Fiona has done assessments in Chad, and we all find the same things. The psychosocial distress is very high, really very high, and the number of mental health conditions is very high. Related to what happened to people in Darfur, major exposure to violence, people lost many dear ones, many livelihoods and their belongings, but also the situation in Chad itself. It's one of the poorest parts of Chad where people go to. A lot of poverty, food insecurity, and the living conditions are not good, I must say. Especially at risk, as always, are children, survivors of sexual violence, but also people with severe mental illness and older people, particularly the ones with limited support networks. On top of that, that eastern part of Chad has a very weak mental health system. The whole of Chad doesn't have a good mental health system because, in fact, there was only one psychiatrist in the country and he passed away a few years ago. So and there are no schools for psychiatric nursing, for example. Next slide. In that setting, things have happened. Over the last 2 decades already, and that's well documented, major NGOs responded to that first crisis. International Medical Corps, International Rescue Committee, HIAS, they did fabulous work in integrating mental health into primary care and also to build community-based psychosocial services. I've seen it, good work. But over the years, funding reduced in that emergency, and when the new emergency came, not that much funding was allocated. So the dependency of international NGOs and international organizations is an issue. Fortunately, we see that there are progressively national NGOs taking over. It takes time to build capacity, but we clearly see in the east of Chad that national NGOs are getting stronger, which is really a sign of hope. Things do happen. In 2024, our health information system for the refugee facilities that UNHCR supports recorded 30,000 consultations for mental, neurological, and substance use conditions. That is a lot, but it's by far not enough. Then in one province, in Wadai, 85,000 people participated in psychosocial activities in communities led by NGOs. That's great. By far not enough. In 2025, some additional initiatives, and they're just too good not to mention them. The Chadian Association of Psychologists, with support from WHO, IOM, UNICEF, UNHCR, UNFPA, sent psychologists to one of the most affected provinces. And it's great. The effects of what these psychologists did was good. They could do psychological first aid. They referred people with severe mental health issues to health centers. And in general, they created social connections in communities that were fragmented by displacement and war. Another initiative by Zeina Awad, a deployee from the Dutch MHPSS support mechanism. She was hosted by UNHCR, and she trained national staff, Chadians, and also Sudanese community mobilizers in psychological first aid. And not just in psychological first aid, but in how to train others. Brilliant initiative and really heartening. Other examples is that mental health and psychosocial support is really integrated into programs for gender-based violence, for education and others. So there are really signs of hope. But, next slide. ultimately, the humanitarian response is not sustainable. We have some money now, but we need to find ways to make our work more sustainable. And that is a big challenge. Next slide. Now, one way to do that is the Green Tree Acceleration Plan that was already mentioned by Fiona in her introduction, which is funded by the Wellcome Trust, a major medical research charity. And they are moving more into public health now, global public health. So the plan in Chad, you see lots of partners are involved. On top, of course, the government of Chad, the UN agencies, including mine, but also UNFPA, NGOs like Action contre la faim, World Vision, but also on the bottom, national NGOs. Very important. It's one big consortium. And the idea is that all these actors together will do a few things, but do them well and scale them up massively. And the three things are, one, strengthening the national mental health system. There is some work needed on mental health policy, making sure there are some specialists in the country, but also training non-specialists through what we call MHGAP documents of materials by WHO. You can train general doctors and nurses in providing basic mental health care. That needs, it is happening, but it needs to be done more consistently and be scaled up. Secondly, we need to go beyond a narrow medical model, and we need to make sure that people who need psychological interventions, counseling, can get it. We chose one intervention, problem management plus, 5-session counseling, well documented. We want to scale it up in communities massively. We also want to do a kind of pilot where we can see, does it make a difference if you add livelihoods components, particularly for vulnerable women who may have experienced gender-based violence. 3, not forget the children. For children, it's always difficult because the age, the developmental age makes it hard to make one intervention, particularly if it's talking intervention. So we chose an intervention that works through movement. It's called Team Up. Also well-researched. And we want to provide that in communities massively as well. So really the idea here is to choose evidence-based interventions and scale them up as good as we can by linking them also into community systems as well as into national systems. Because in the end, these community systems and these national governmental systems have to take the work forward. Next one. This is my last slide. Basically, this for me is the way forward when we talk about humanitarian work and integrating it into sustainable responses. First is to integrate mental health and psychosocial support in all the work that we do, not just a narrow, small sector of only some psychologists and psychiatrists. It needs to be integrated, and there are good examples. The minimum service package that Dr. Fahmy mentioned is a brilliant example on how you can help actors to do this. Secondly, we need to double down on localization, working with local and also refugee-led organizations. I've seen brilliant Sudanese refugees, highly qualified, highly motivated, but not always given the opportunity to help their communities. So that's the second one. And third, of course, is linking with development actors, including multilateral development banks who are interested, like the World Bank. They do see the need to integrate mental health to keep countries stable. But we need to work hard to realize that. And what we do need is high-level advocacy, which is why the Green Tree Acceleration Plan is so important. It's Amina Mohammed, the Deputy Secretary General, who puts her weight behind it. And it's Julia Gilliard, the ex-Prime Minister of Australia, who is now the chair of the Wellcome Trust, who really says we have to do this by joining forces. Thank you very much.
Thank you very much, Peter. Indeed, integration for profound outcomes is the way to go. I'll continue to invite our next speaker, Rita Taye, who is the Mental Health and Psychosocial Support Global Lead Surge. Kindly put on your speaker on, Rita.
Yes, hello.
The floor is yours.
Thank you so much, and warm greetings to everyone joining us today. I'll be sharing a glimpse of my experience as a member of the RBO Surge mechanism that is supported by the Netherlands Enterprise Agency. And this mechanism plays an important role in humanitarian response by rapidly deploying experts to countries in times of crisis, basically to strengthen coordination and build local capacity and ensure that mental health doesn't fall through the cracks of emergency response. But it's not just about being fast, it's also about being connected, because each surge member is part of a global network of peers, mentors, and technical experts who stands ready to support. What also makes this mechanism very powerful is its interagency and cross-sectoral nature. And more recently, it has expanded its focus within the humanitarian development peace nexus, working more intentionally to bring MHPSS and peace building closer together, to be able to support communities not only to cope, but also to rebuild relationships, foster dialogue, and restore the social fabric. Next slide, please. So let's zoom in into my most recent deployment that was in Lebanon, a country that has endured multiple overlapping crises and more recently the impact of war. And when a crisis hits, what happens to mental health? Often people's well-being is the first thing to be shaken and one of the hardest to rebuild. And what does it mean to work on mental health during times of emergency? It means facing stigma that keeps people silent. It means working in an economic collapse that makes it even harder to find the resources to support people's needs. And it means trying to support frontline workers who are themselves exhausted, displaced, or grieving. So during my deployment with WHO, I had the privilege of working alongside the National Mental Health Program, and I witnessed how both teams and the partners constantly had this question in mind. How can we build a system that responds to today's crisis and is strong enough to face tomorrow's? So what did we do? Next slide, please. One concrete example was organizing a series of multi-sectoral workshops using the minimum service package. These workshops brought together over 100 decision makers from UN agencies, NGOs, and ministries. And something powerful happened in those rooms. People who haven't connected before began to collaborate, to plan together, and to align their vision on what a stronger MHPSS system could look like. Another example is the establishment of a core coordination group that is an inclusive platform bringing together different ministries, UN agencies, academic institutions, NGOs, and service users associations. It is a space not only for coordination, but also collective problem solving and shared ownership. And finally, we worked on adapting a national emergency response plan that integrate preparedness, response, and recovery while keeping sustainability at the center of each step. And now, looking back, a few reflections stay with me. First, that coordination is about people before it's about structure. It is built on relationship, trust, and shared purpose. Second, that evidence-based approaches help us build systems that are not only reactive, but adaptive and ready to change as needs evolve. And third, that sustainability must begin on day one, because what we build during an emergency must be strong enough to stand long after the crisis fades. And in closing, I really want to honor the dedication and humanity of all those working to make mental health a priority in emergencies. In Lebanon, I witnessed first responders and local actors, many of whom were displaced and affected themselves, continuing tirelessly to support others with empathy and courage. And that, to me, is the spirit of the RVO search mechanism. It's not just about rapid deployment, it's about rapid solidarity. It's about showing up, standing together, and believing in communities and their capacity to heal, rebuild, and lead their own recovery. Thank you.
Thank you very much, Rita. Indeed, solidarity, togetherness is the way to go. We give you a salute and all colleagues who stand in front during emergency response. I'd like to turn into our final speaker for the day, Anne Filoriza Pla, the Mental Health and Psychosocial Support Global Lead at Save the Children. Over to you, Anne.
Thank you, Fiona. Every day, every hour, children and adolescents are affected by emergency around the world. And too many lose their life. And among The ones who survive, many live with serious distress and psychological challenges. Evidence shows that exposure to natural disaster, violence, separation, and nutrition exploitation deeply harms in the short, medium, and long term. On this day, we celebrate mental health. But maybe we should ask ourselves the right question. Why there are still many children and adolescents denied their right to mental health when the crisis happened? Didn't we agree that children and adolescent mental health should be at front and central? Do I have to go again explaining that MHPSS remain life-saving? And I hope that I don't have to convince you again. So here is my question. Why? Why this right is still not reached, is still denied? My team, our team, they keep asking this question. How can we do that better? How can we ensure that every child, every caregiver in emergency know who to call, where to go, what to do which is not going to harm them, how to cope positively? And one of the first things that came to our mind and that has been repeated by our colleagues might be, maybe we must begin by ensuring that humanitarian workers, volunteers are safe, supported, and trained to identify and assist children in distress. If you want to have access, you need also to know, to outreach, to know where are these children, how can we show them where to go safely, but also for them without harming themselves. I really would like to take the opportunity to thank all of your colleagues, humanitarian worker, volunteer, colleagues at country office, and even in headquarters. Thank you for your dedication. Thank you for your tireless work in Ukraine, in Yemen, in Afghanistan, in Gaza, in Syria, in Sudan, in South Sudan, in Nigeria, and the list is far too long for the time that have been given to me. But thank you for continuing to devote your life protecting children and families. Colleagues, we see you and we are immensely grateful for your work. So we must ensure that this safe, this trusted adult exists, but we need also to ensure that this trusted person understands child development. How do you communicate with empathy? And we have an example of how to train with the child and adolescent mental health diploma that we designed for this to promote this. Because we do know that early intervention, especially before the age of 14, when half of the mental health condition begin, can reduce the lifetime risk of depression by up to 50%. And obviously, we need to listen to children's voice. Their participation needs to be meaningful, please, not symbolic, not just like something you tick on your checklist. Children and adolescents know what support their well-being. And if they don't, it's still our duty to act. We still need to ensure their dignity and do it with care. Finally, we need to continue to advocate to government to develop a strong child and adolescent mental health policy. We need to link education, health, child protection. Only a true multi-sectoral collaboration can ensure that children in distress are protected and supported to realize their rights. The cut on MHPSS on mental health and psychosocial programming have been devastating. The consequences have deepened the suffering into families, undermining recovery within communities. So more than ever, we need to remind what mental health is and fight discrimination. And we need you to join our advocacy and to support you and find inspiration. Our colleagues will put a link for you to access our multi-agency resources advocacy paper on humanitarian action. Together, please, let's make mental health a right for every child, everywhere, and at all times. Thank you very much.
Thank you. And indeed, that is so profound. If we know we can reduce depression by 50%, so what is the reason that we don't want to actually act on it now? Why should we wait to treat when we have the power to actually provide early interventions? Thank you very much for sharing that insightful inspiration. We want to appreciate you for listening and for joining. We are over 1K and we want to let you know that we appreciate your time. And as we move on, I will invite to Yoshi Akioma to respond to the question, why must mental health in emergency be prioritized as a core component of humanitarian response? I know this sounds familiar and very profound, that we have actually drummed for many years the prioritization for mental health, but we want you to briefly just let us know, why should it be a core component, not a by the way?
Access to mental health is already a problem. It is never easy. However, under emergencies, catastrophes, of course, the situation gets exacerbated. As I said, sometimes people may be dehumanized. Then it enhances the need or lack of the service access by 10 times, 20 times, 50 times. So mental health access is always important, but under these conditions, situations, we feel the need very painfully. That's the reason why we chose this theme. Thank you.
Thank you very much. Indeed. I'll turn to Raija, your wealth of experience, particularly, working in humanitarian response. What do you see as why it is really not just a priority, but it has to be a core component, to be integrate mental health in the response, just equal like any other humanitarian needs? Why is mental health important, Raija?
Yes, thank you, Fiona. It's very important. First, because mental health, it upholds dignity and human rights of people. Second, what also mentioned, Fahmi was mentioning, it has been in the world, in WHE Assembly, it's a resolution now that we have to put it in our preparedness, response, in everything to be integrated. Second, I think it's with the disruption of people's life and the destruction, the level of stress will increase. Therefore, it's very important for us to be able to work on the mental health of the people. It will also facilitate the recovery and the resilience and being able to have more hope. So this is something that we need to work on. And of course, not to forget, people with mental disorders, they will have a problem to reach the basic needs. So it's important to have it in our minds whenever we have any emergency, that we need to respond and to provide support to people with mental disorders. And second, I was saying that neglecting mental health delays recovery and of course ensuring caring for the carers who are providing the support in emergency. I mean, like in Gaza, in the last 2 years, they have not stopped working. We need to support them. Therefore, mental health is very important to be integrated in the emergency response from the beginning, from preparation, planning, responding, and implementing. Thank you, Fiona.
Thank you. Very profound. Indeed, for better outcomes, we have to integrate mental health in preparation, before, during, and after. I would like to turn to Pinta Ventavo from UNHCR. You've really been key to actually develop guidelines, policy frameworks like the interagency guidelines, the minimum service pack, the WHO Comprehensive Mental Health Action Plan. How do we move all these global guidelines into practice that the field offices can actualize into measurable, equitable outcomes of people affected by crisis? What do we need to do to make sure that these policies are relevant and these guidelines are relevant for measurable outcomes?
Yeah,
Peter.
Fiona, that is the $1,000 question, of course. First of all, I must say we have made great progress. When I started this work some 20 years ago, there were actually no guidelines. People just did what they thought was the best. We now have really solid guidance that is made by multiple agencies, like this IASC guidelines from 2007. That's really the birth of humanitarian mental health and psychosocial support. But also super important, this minimum service package. And then WHO, extremely important with the member states, this mental health action plan. So the guidelines are there, but how can we make sure they're used? Few things. First, people need to know about them. And that requires capacity building. So to give an example, on that minimum service package, together with UNICEF and WHO and UNFPA, UNHCR has done many capacity building workshops, and it makes a difference. We've seen it in Ethiopia. Many workshops, we see it makes a difference. People get it, people start to collaborate and around exactly the same topics and the same interventions. It helps. But that's not enough. We also need to make sure that it is known by, let's say, the decision makers. And how to do that is, one thing is to make sure mental health is well represented in, let's say, policy documents. So for humanitarian emergencies, you have these humanitarian response plans, very high level often, but super important if you have MHPSS well mentioned there, because that's the basis of the next phases of action. Similarly for refugee response plans in refugee settings. So that's really important. And that needs to be paired and linked with national policies. So for example, the example I gave in Chad, it is important that the government then starts to use these tools and ingrain them into national policies and guidelines. So that's the second point, make sure that it's in high level documents. And the last one is basically to connect these two is you need champions. And I would say there are many champions, but one group are people from the ground, people with lived experience, people who can really talk about how mental health interventions have helped them. Secondly, that's bottom up. Top down, you also need people. You need high-level people like Amina Mohammed, the Deputy Secretary General. There are other high-level people. Tom Fletcher, the head of OCHA, the big coordination agency for humanitarian aid. He has been to Gaza and he talks about it. You can find the video. He talks how it has affected him to see all the violence and the suffering. He understands it. We need policymakers who understand it. Thank you.
Thank you very much. All of us are needed to be able to move this. I would like to ask a final question to Anne. You've mentioned a lot around children and frontline workers very deeply. And I would like to ask you, how can we ensure that children and families and frontline workers are not just recipients of psychological aid, but active participants in designing, sustaining mental health responses during emergency response? So over to you, Anne.
In 2 minutes, which would be like an answer of minimum half an hour. I think the first point is we need to remove this assumption that children don't understand or they can't express their need, or what they do is crying or doing a drawing and everybody's happy. I mean, children has a lot to say and they have a way to express it, and it's a work. It's a consultation work that we need to put in place in a mandatory way to very much understanding how they can be better supported within crises. At the same time, I suppose if we created more participatory programming, I mean, we have I Spot My Friends, which is an interagency with Save the Children, UNICEF, WHO, the collaborative. We created this PFA for children where they learn empathy, peer support, coping mechanism, instead of using stigma and bullying. This program built the child confidence and skills to advise, to help, to shape the response that affect them. So if you involve from the beginning in preparedness, in anticipatory action, youth, adolescent, and younger children, whenever you have the resources to do so, well, you have a response which is much more relevant, which is owned by the community, which is owned by the children. Frontline worker, as I mentioned before, they need support, they need mental health support. They need to know that they are understood and that the fact that they have to accompany persons who are facing very stressful or traumatic situation, that they also have a backup, that they also have someone who supervise, who accompany, inter-supervision. We can be extremely creative. But what we need is capacity sharing, strengthening, building on together with colleagues who have experience, understanding of the culture, understanding of the context, and help us to adapt the different tools to have an answer which is, again, owned by the community, owned by themselves, and hopefully which created a much more sustainable well-being for the whole community. Over to you.
Thank you, Anne. I would like us to wrap up, and I would like to invite Fami to give us key takeaways for today's World Mental Health Day. Over to you, Fami.
Thank you so much. I think this inspiring inputs from all the panelists and the great question we got, we have drawn together the mental health and psychosocial support bridge, the bridge from suffering to coping. We need to lower it, fund it, staff it, coordinate it, and hand it. Fund it, donors, please fund it. Staff it, policymakers, please staff it. Coordinate it, mental health and psychosocial support experts across sectors. Together and hand it to local champions and local communities. A good colleague was asking about localizations. Indeed, all the work we do and discuss need to be totally built with and owned by local communities, as what we have in IC guidance. Investing in mental health and psychosocial support, as many speakers emphasized today, and many of you in questions, is the only bridge for recovery. When the next siren sound is heard, and actually while we speak now, I saw on my app some siren sounds was somewhere in some emergencies, such as Ukraine is ongoing. When next siren sounds, access to mental health and psychosocial support in all next emergencies and ongoing should not be only an aspiration. It needs to be our standard practice across sectors and across all emergency phases. Mental health and preparedness response and recovery, covering universally everyone, everywhere where they need it, is a right, not a luxury or add-on. Humans don't live only with water, food, medicine, and shelter. They need much more to be able to cope and thrive. I thank our Mental Health Innovation Network colleagues for hosting us today. Thank you, Joy. I thank our World Vision colleagues for moderating today's session, our great partners who selected the topic for this day, the World Federation for Mental Health. Thank you so much. Save the Children for highlighting the needs of children in emergencies, our colleague in WHO Palestine for the incredible work you're doing in the front lines that the world clearly needs, the great work done by the Dutch Surge Support, RVO, and Rita, particularly in Lebanon during some of the most difficult time, is a great example for localization. Rita is from Lebanon and was deployed in Lebanon during some of the most difficult times and days. I thank my colleagues in WHO Geneva for their work and for their support in this webinar, particularly my colleague Maya Bashit. I thank you all. And when we get asked, is there hope in this world? I think the very fact that we had more than 1,000 people staying for 1 hour, listening to panelists coming from all continents of the world, responding to emergencies from multiple organizations, UN, NGOs, and civil society is a source of hope. Keep up going all the good work and your commitment to mental health. I hope this day is a renewed commitment for us for the value of mental health, including in our own life. Thank you and happy World Mental Health Day.
Thank you indeed, everyone, for joining, and particularly for World Health Organization, the World Federation of Mental Health, and the Mental Health Innovation Network for organizing this event. I also wish to thank all the speakers for sharing your valuable inputs in today, and also our two colleagues behind the screen, Joy Muya and Maya Bachat, for all the coordination behind the screen. And to you all for staying on call for 1 hour, we want to appreciate you, and we want to let you know that all the recordings will be sent to you after the presentations. And we also want to appreciate those who have put their life at the forefront to actually respond to humanitarian emergency. We want to thank you and appreciate you and remind you to still check the resources and the key messaging on World Mental Health Day, which is mental health in emergency matter. Investing in mental health is investing in recovery. Protect your mental health. Mental health is essential for rebuilding lives. Mental health care saves lives, promoting mental well-being through multiple approaches, integrating mental health, strengthen emergency response, inclusive mental health care, build stronger communities, and protect the well-being of humanitarian workers. Thank you everyone for joining. We want to wish you all the best in your work, and we want to wish you a good mental well-being as you mind your mind, as you respond in wherever place you are. Thank you, everybody.
Thank you, Fiona. Thank you, Peter. Thank you, everyone. Thank you, all colleagues.
Thank you.
True.
Bye.
Yoshi, thank you so much. Thank you.
Thank you so much. Thank you, everyone.